Also, a bulletin brought you a report of UNESCO and UNICEF and the World Food Programme showing that 1 in every 3 schools in the world lacks access to drinking water and basic sanitation facilities. Now, joining us from Paris, France, I have Christopher Castle, the head of the Health and Education section at UNESCO. He joins us to shed more light on this report. One welcome to you, Christopher. Thanks for joining us on News Central Now.
Thank you very much. Such a pleasure to be with you.
Now, Christopher, let's bring it home to Africa. How does the continent fare in this damning report?
Well, you know, overall, the report looks at the situation and the status of health and well-being of children and young people in schools all around the world, and we also have specific data in the report for Africa. Of course, one of the things the report tells us is that countries are investing more and more in their children and adolescents because they realize how important that is for the futures of their countries and the health of those children and young people. We, of course, know that healthy and well-nourished and happy children will learn better and are more likely to lead healthy lives. For example, learners are 50% less likely to skip school when the learning environment is free from violence, and absenteeism is reduced in low-income countries, and particularly for girls during menstruation, when promoting hand washing and when water, sanitation, and hygiene is improved. So this is really why learners' health and health education must be at the heart of all education policies.
Now, Christopher, nice to know that there are positives there on the investment in education for adolescents and young learners. Now, for a clearer perspective, what are the impacts of and effects on children when they're exposed to learning in a poor environment and poor nutrition, and also in an unsafe environment?
Well, we know, of course, that unfortunately many children are still missing out on school altogether, or even if they are in school, they don't learn very well due to illness, hunger, and for girls, early and unattended pregnancy can be a big impediment, just to name a few of the issues. Overall, 73 million of the most marginalized children are not reached by school feeding, for example. 1 in 3 schools worldwide do not have basic drinking water and adequate sanitation. You asked me specifically about sub-Saharan Africa, and there we know that it's less than 1 in 2 who have access to basic drinking water and adequate sanitation. 2 out of 5 children without basic drinking water services live in sub-Saharan Africa. So we have a lot of work to do, but the good news is countries understand the importance of addressing safe learning environments and healthy learning environments so children are attracted to schools, stay there, and are able to learn. In fact, when I mentioned the issue of unintended pregnancy for girls, one of the things we see more and more countries doing is strengthening their sexuality education programs as an evidence-based strategy to reduce early pregnancies as well as new HIV infections.
I'm happy you mentioned a lot of work to be done, and that's what needs to be done to get rid, to improve on this statistics, especially as it affects African young learners. Now, as UNESCO, what interventions are in place to help curb all the challenges you've mentioned, and in what ways do they collaborate with national governments of these countries?
Thank you for that question. Actually, for UNESCO, school health and nutrition are a core part of our education mandate. And of course, we also work very closely with other UN, United Nations agencies like the World Food Programme, you mentioned them, or the World Health Organization, or UNICEF, or UNFPA. So we work very closely with those other UN agencies because we understand the importance of delivering a comprehensive response to the health and well-being needs of young children and young people. For UNESCO specifically, we support a program called Our Rights, Our Lives, Our Future throughout 33 countries in sub-Saharan Africa that focuses on learning, enabling children to learn about better health and well-being so they can make healthier choices. And that may mean choosing to delay marriage and delay pregnancy, for example. So there's lots of things that can be done and that UNESCO is currently engaged in. We work with national ministries of education in sub-Saharan Africa to help train teachers, to support them to revise their curricula, so that curricula is up to date and evidence-based, so that what's being taught is absolutely the most recent, current, science-based approach.
Thank you very much for your time and insights, Christopher Castle. We do appreciate it.